Welcome to this 10-minute comprehensive masterclass on managing varicose veins and improving your vascular health. I'm Dr. Deepins. Many patients come to me feeling overwhelmed by their symptoms, the heaviness, the achiness, and the cosmetic concerns. Today we are going to provide you with a definitive medical roadmap. We'll explore the hidden anatomy of your legs, demonstrate a clinical 12-minute bedtime routine, and discuss the science of prevention. This is your guide to feeling like new. To truly manage your veins, you must understand the highway of your legs, the great saphenous vein. This is the longest vein in your body, and it's where most varicose issues begin. Unlike your arteries, which have the heart as a powerful pump, these veins rely on delicate one-way valves. When these valves stretch due to age, genetics, or prolonged standing, blood doesn't just flow, it refluxes. It pools at the lowest points, creating the pressure that leads to bulging and discomfort. Understanding this anatomy is critical to your recovery. Think of your legs as a hydraulic system. When you stand or sit for 8 hours a day, you are fighting a constant battle against gravity. This leads to venous hypertension, literally high pressure inside the veins. This pressure doesn't just cause bulging, it causes fluid to leak into the surrounding tissues, which is why your ankles feel swollen by 5 p.m. Our bedtime routine is designed specifically to counteract this 8-hour accumulation of pressure and manually assist the venous return. Your diet is a powerful ally in vein health. We need to focus on bioflavonoids, which are compounds found in citrus fruits and dark berries that strengthen the collagen and elastin in your vein walls. Equally important is fiber. Chronic constipation creates significant internal abdominal pressure, which directly impedes the return of blood from your legs. By maintaining a high-fiber diet and staying hydrated, you are effectively reducing the physical barriers to healthy circulation from the inside out. Not all exercise is created equal for varicose veins. High-impact activities like running on hard surfaces or heavy weightlifting can actually increase venous pressure and worsen symptoms. Instead, I recommend low-impact activities like walking, swimming, or cycling. These activities engage the calf muscle pump without the jarring impact that can damage delicate valves. The goal is consistent, rhythmic movement that promotes flow without excessive strain. Remember, motion is lotion for your vascular system. Clinical studies show that a specific 12-minute intervention of elevation and mobilization is the sweet spot for vascular recovery. We aren't just resting, we are manually assisting the venous return. This routine is divided into 3 critical phases. Phase 1 is passive drainage, Phase 2 is active mobilization, and Phase 3 is final stabilization. We are going to walk through each phase together right now. This is where the manual reset begins. We begin with 5 minutes of elevation. The key is the 45-degree angle. You want your feet above the level of your heart. As you lie here, your breathing is your most powerful tool. Diaphragmatic breathing deep into your belly, actually creates a negative pressure in your chest cavity. This respiratory pump acts like a vacuum, pulling blood from your legs up toward the heart. 5 minutes here resets the baseline pressure in your entire deep vein system. Now, for the next 4 minutes, we engage your second heart, the calf muscles. When these muscles contract, they physically squeeze the veins, propelling blood upward through the valves. We'll perform 2 minutes of slow, clockwise ankle circles, followed by 2 minutes of counterclockwise circles. Do not rush this. You should feel the rhythmic squeeze and release of the calf muscle belly. This is active mobilization, ensuring no blood remains stagnant in the lower extremities. The final 3 minutes is the bed cycle. This integrates the entire leg, from the toes to the hips. These fluid, low-impact movements prevent any bottlenecks in the groin or upper thigh area. By the time you finish this 12-minute sequence, you have manually processed the volume of fluid that has been weighing you down all day. You're now ready for the restorative phase of sleep with a balanced and refreshed vascular system. Beyond the routine, we must discuss compression therapy. Many people find stockings uncomfortable, but that's usually due to incorrect sizing. Proper medical-grade compression is graduated. It's tightest at the ankle and gets progressively looser as it goes up the leg. This mimics your natural anatomy and assists the valves. I recommend a Class 2 stocking for most symptomatic patients. The key is donning them first thing in the morning, before any swelling begins, to prevent damage before it starts. For those of you who work at a desk, we need to talk about desker sizes. Sitting for hours is a primary risk factor for venous stagnation. Every 30 minutes, perform 20 seated calf raises. Simply lift your heels while keeping your toes on the floor. Follow this with heel-toe rocks. These micro-movements ensure that your second heart is never completely dormant during the workday. Small, consistent actions are the foundation of long-term vascular health. Another powerful home remedy is hydrotherapy. Specifically, ending your shower with 60 seconds of cold water on your legs. The cold temperature causes your blood vessels to constrict, a process called vasoconstriction. This trains the vessel walls, improving their elasticity and tone. It also provides immediate relief for the burning sensation, often associated with varicose veins. It's a simple, free tool that you can integrate into your daily routine starting tomorrow morning. Let's talk about the journey. After 7 days of consistency, you'll notice less nighttime cramping. By day 14, the evening heavy leg sensation begins to lift as your valves get a chance to recover. And by day 30, the underlying inflammation in your vascular walls is significantly reduced. This is a physiological transformation, not just a temporary fix. Stick with the routine. Your body needs time to repair the damage of years of pressure. Travel is a major stress test for your veins. On long flights or drives, your blood is fighting a losing battle against gravity without the help of the calf pump. My top medical tips: wear your grade 2 compression, perform seated heel-toe rocks every 15 minutes, and stay aggressively hydrated to prevent blood thickening. Never sit for more than 2 hours without a 2-minute walking break. These habits prevent the travel swelling that can lead to more serious issues. I often get asked, Dr. Deepins, when is home care not enough? If you develop skin ulcers, spontaneous bleeding from a vein, or signs of deep vein thrombosis like a warm, red, painful calf, you need to stop home routines and see a vascular specialist immediately. Modern surgery is minimally invasive, but our goal is always to use these natural interventions to keep you off the operating table for as long as possible. Knowledge is your best defense. The work doesn't end when the 12-minute routine does. To maximize your results, try to maintain a slight elevation while you sleep. A 6-inch wedge under your mattress or the foot of your bed can maintain that low-pressure state throughout the night. Avoid sleeping on your stomach, as this can impede pelvic circulation, and try to sleep on your left side to optimize the return of blood through the vena cava. These sleeping habits ensure your veins are recovering for a full 8 hours. A common question is the difference between spider veins and varicose veins. Spider veins are small, superficial vessels that look like webs. They are primarily a cosmetic concern. Varicose veins are larger, deeper, and often bulging. While spider veins can be a precursor, varicose veins represent a more significant failure of the venous valves. Both respond well to the routines we've discussed today, but varicose veins require the more diligent management we've outlined in this masterclass. We've covered a lot today, from anatomy and nutrition to our 12-minute reset and advanced travel tips. My goal is for you to feel empowered. Commit to the 30-day challenge. Do this routine every night for 1 month. Your legs have supported you for a lifetime. It's time to give them 12 minutes of support in return. Thank you for joining this masterclass. Subscribe for more deep dives into your health. I'm Dr. Deepins, and I'll see you in the next video. Stay active and stay healthy. To recap, elevate for 5, pump for 4, and cycle for 3. Combine this with proper nutrition and compression for the best results. I've included a downloadable checklist in the description below to help you track your progress. Remember, your vascular health is a journey, and every small step counts. I'll see you in our next deep dive. Stay healthy and keep moving.